Good afternoon, one and all. Today, we are discussing a very important topic why training in digital health is important. And for this, we have with us Dr. Rajendra Pratap Gupta, founder, Digital Health Academy, Dr. Ram Kumar Kakani, director, IIM Raipur, Dr. Sanjeev Prashar, IIM course director, and Dr. Almas Fatima, who is our student of batch one. She's a doctor, a family physician at Alcura Family Clinic. And we also have with us Dr. Sunil Khetarpal, Director, Association of Healthcare Providers, India. So this is regarding a course that we provide at that together jointly with Digital Health Academy and IIM Raipur. The Certified Digital Health Professional course, popularly known as the Postgraduate Certificate Program in Digital Health and Diploma Program in Digital Health. Now, I would like to hand over to Dr. Rajendra Pratap Gupta, who will introduce the course in a very formal and a better way.
Thank you so much, Priya, and thank you, Professor Ram, Professor Sanjeev, Dr. Almas, and Dr. Sunil, who is going to join us in a while. Beyond and before we get into the specifics of the course, I want to also, discuss with Professor Ram and Professor Sanjeev, how has technology been invading the other domains, other sectors? Because it's today a reality that technology is an integral part of all that we do. So I would put it to Dr. Sanjeev Prashar. Dr. Sanjeev, how do you see technology in the realm of management education?
Namaskar and good afternoon, everyone. I'm Sanjeev Prashar and I'm Program Director from Indian Institute of Management, Raipur. We started this particular program last year, and first talking about what exactly has been posed to me by Professor Gupta, technology and education. In the simplistic sense, technology brings in a huge scope and scale into education. The first most important, if I am a student of any program, I have an access to the world's best faculty, and that's what exactly is symptomatically also available in our own program. Rajendra, you have already have the best of the portfolio of faculty members across the world. You have chosen each and every person over there who actually has a say in the policy matter, who has a say out there into the execution of health and technology over there. You have brought in every element possible in the human sense, starting with health organization, and then all the US agencies on that side, and then United Nations allied agencies also people. So technology is the first most important facilitator in bringing the people of the best possible caliber at the platform to discuss. Now, when I say faculty, corollary immediately goes to my second thought. And the second thought is, with these faculty comes the best of the content and the knowledge. Now, what exactly is happening over there as of today can outrightly put into assimilation for transferring of knowledge to the people. And this is what exactly is also the forte of this program. Over the period of time, another few moments down, each of the participant or each of the attendees over there in today's webinar would come to know from our first batch students as well as from other resource personnel also what exactly is being delivered, the experiences, the experiments, what are the systems that are being created, what are the processes that have been built over there, and what exactly is ultimately the shape that digital health is taking. It's all because of the paradigm of technology, and that's the second important thought that I just wanted to talk to you people. The third very important is most of the people invariably fear that for such programs, invariably we are at the remote corners, someone in Brazil, someone in Italia, someone over there in Japan, Hong Kong, Singapore, and someone out there in Africa, as we happen to have even students from abroad in our first batch. But the good part over there, Mr. Gupta, Dr. Gupta, is there is a peer sharing. You learn, you share your thoughts, you share your knowledge, you share, even you can ask, seek clarifications from the people across the different economies just because of technology. And that's where we stand apart, we stand ahead over there in this particular system. Now just imagine the developed economies which are high developed out there on technologies like US and Canada and the rest of the UK and all, Japan. These people are on the different stage of evolution. India is on the next stage of evolution. Some countries in Africa and some other countries over there, they may be at a different levels. But when it comes to knowledge base, then each country has its own issues and perspectives. So every country can share. And this is only possible because the technology is available to we people. And very important, fourth important fact is, since most of you people, the participants over there for such programs, are working executives, and more specifically into health, we understand and which each one of us respect that you people nearly work 22 to 24 hours a day. It's just not possible for you people to move out of your chairs, to move out of your operation theaters, or from wheresoever you people work at different workstations. This is the technology that gives you a space. This is the technology that adds to your time, wherein program being asynchronous, so you can have the leisure of learning at your own pace, at your own time, whenever you people have. And this is because internet is available, internet is all universal and all pervasive, and that's very important. And the last very important over there is what exactly we people do through technology is, we not only grasp the knowledge, but we also evaluate through self-assessment that happens every week over there. Self-assessment would not have been possible if there was not technology. So what we do over here is we assess, evaluate our own performance, we learn. So our feedback is something taking a shape of feedback forward just because of the technology and grab on. So Rajendraji, in brief, what I think, this is how exactly the technology is helping not just management education, in general, even at the specific perspective level also, it's health, it's blockchain, it's finance, it's every stream over there for education. Technology is coming to us. More or less technology has emerged as a panacea. Thank you.
Thank you, Dr. Sanjeev. Dr. Ram, are you
Professor Ram is just joining us a while.
Okay. So in the meantime, I'll continue. So, last week, Commonwealth asked me to make a presentation to them, and they formed the Commonwealth AI Consortium. I mean, the level at which technology is getting all pervasive, within every domain, every sector, I think even the multilateral bodies, which so far were like very slow, very calculative in terms of making their moves, have a reason to believe, like UN appointed a tech envoy, who is an Indian, Amandeep. UN is actually considering a special body to regulate AI. So you can imagine at the level technology has reached. And when almost like 3-4 years back, actually 4 years back, when I looked at the entire domain of health, having worked in it, I realized one thing was certainly going to come, and that is that technology is going to be a part of all that you do. And when I look at the last couple of years, I think it was a good decision to say that, let's at least make a move to start training people, because if you don't train people on digital health, as this domain evolves, they would not be able to, keep up with time. I think one of our people who enrolled in the course made a very important point that in next 5-6 years, this will change. At least I'll be prepared, of the things that will come. And Dr. Ram has joined. Dr. Ram, you have been veteran in the management education, in administration, beyond management as well. You have been a part of many IIMs, many government initiatives, and most recently the youth 20, so you're actually looking at the future of how the education system would be. So as you look at all the sectors, how do you see technology invading those sectors, and what has been your experience as director of IIM Raipur, plus the mentoring that you do to others?
Okay. Thank you, Professor Rajendra, for giving me the, you can say, honor of being part of this particular seminar. So first and foremost, a warm welcome to the webinar participants. Thank you for taking out time and joining us. Let me also apologize to each one of you that I've been a little late because of a certain delay in traffic and some other engagement which I was caught, you can say, caught entangled into. As far as the question of Dr. Rajendra goes, let me put it this way. I'll build upon the story which my colleague Professor Sanjeev was mentioning. You see, what does one need to do big in the industry or in one's career, whether it is in terms of a hospital or health or something, or even policy making? You need one, behavioral competency, you need functional competency, you need domain knowledge, you need passion for that particular area, that you need to feel that that's a purpose out there which you are living in for. And last and not the least, the socio-economic geopolitical part of it. And if you observe the modern day, you can say, technology aspects that essentially have been mentioned, technology has an intervention in each of this. Let me give you a small example of it. Imagine being a doctor and unable to comprehend some of the language which digital healthcare has. Or imagine imagine a situation wherein you're not able to use words which possibly the digital healthcare sector essentially has. You might have been there, done that. You might be the best of the doctors, you might be the best of the policymakers, you might be the best of the, however, the fact that if we have a certain, disadvantage largely creeping in because of technology, that can result in a massive bottleneck out there. And in that sense, I put it this way, that it's a very apt question. Without having knowledge of the modern day, technological aids that are there for healthcare, it becomes very difficult to survive in the sector, or even forget about even making an entry into the sector. And for a sector which essentially is nearly, I would put it this way, as minimum 6% of the GDP of any economy whatsoever, I guess it tells a lot about. It tells a lot on how important it is to know more about technology. That's from my side, Professor Rajan.
Well, I'm very rightly put. And the way those who are watching this, and we are actually doing this broadcast through our Health Parliament LinkedIn channel, which is around 17,000 people, and we'll post this on YouTube as well. The reason, when we put this webinar, we didn't send any questions to any one of you. And that's how technology works. It throws us challenges, it throws us questions for which we'll have to find instant answers. And that's the way technology is going. It will just engulf it. Last couple of weeks have been really enlightening for us, and on 4th, we will be hosting a live interaction with our students with one of the global champions, a course, and then we developed it. Our goal was that as it evolves, we should let our learners, who are very senior people, including Sunilji, who has joined us, Almas, is to give them a sense of what they should be preparing themselves and the healthcare sector as well. So what I'm going to do is maybe make a short presentation about this particular course, because I think as those who are looking at doing a course, they have multiple options at any point in time. Because in healthcare, people will look at either what do you call the health management, what you think as the masters in health management, masters in hospital administration, masters in health informatics. So why exactly a course in digital health? And this is the question I had in 2018-19 when I was conceptualizing the Digital Health Academy, that is this education enough, and being a part of the National Education Policy Committee, where we had looked at what the future would look like. And our Honorable Prime Minister's vision was very clear. Let's prepare a country for next 40, 50 years. So we looked at all, and there was no COVID, by the way, at that time. COVID came quite late. So how we did that is that We, with our teams in the first 8 months, reached out to some 62 people globally, those who are like disruptors within the government, within the private sectors, across geographies. So while some names may sound Indian, they are not Indian. They're like US, Europe guys in global roles. So we spoke with them, asked them what is the need gap, what do we need to do, and the consensus was that while people may want to do anything in healthcare life sciences, we need to bring the element of technology management to it together, because that's where I think most of the people miss out. That's where we moved with these discussions, and we actually figured out there was a huge need for a structured course in digital health. Let me tell you, there's other side also. It's not easy, to have a course as comprehensive as this. We took 3 years. I think many people will jump into, trying to fill the gap, saying, okay, everyone wants to do digital, let's launch something. People have tried as well. And let me tell you that it is pretty much as challenging as to structure a course as to, deliver it. It's far easier to understand for those who are in this field and wanting to be in this field. One is understanding digital health from a complete perspective. Then is the
Rajendra ji, I think slides are not moving. If you could put the
is
slide.
it?
Yeah, if you
Oh,
could.
okay. Wait, let me reshare it. You can see the slides.
Yeah.
Is it moving now?
Yes, it is moving.
Okay, so for the benefit of people, I'll just walk them through the names also. We reached out to people, if you look at people across Asia Pacific, people in Europe, even people who had it WHO, who still had WHO, you can see we have reached out to pretty much people who have been into this field for 45, 50 years, because we wanted to get a sense of what exactly should be in it. And that's where I think the strength of this comes in. A lot of research, a lot of discussions, brainstorming to build this up. So that went on to build, and we realized that people need to understand digital health in comprehensive manner. In fact, yesterday we recorded a lecture on supply chain in healthcare, and we got it from none else than the global chief operating officer of B Medical. They are the world's biggest in this digitalized supply chain system, and these three words which are very sacrosanct for us, and the difference between digitalization and digital transformation, he actually ended up speaking that this is what is needed today in what he's doing. So we record and we deliver lectures from people who are into it at the top level in the world. So people do not understand these three words, and they will have a very important role if you are a practicing doctor, if you're working in healthcare, or if you're on the any level of management. So this has to be taught in a very structured manner. It cannot be, learning anywhere. Then digital therapeutics, DTX. I think those of you who joined us in this summit in Mumbai would have got a sense of it. So the other part is the application-oriented course. Even when you look at the management lectures that come from our esteemed colleagues at IIM Raipur, it is all application-oriented. We recorded a lecture today, and it all talks about what is blue ocean, what is red ocean strategy, why it is important for you, how do you implement it. So this is very important from perspective of people. Health, tech, and management are three things we have merged into one course, which gives people a perspective of what can go wrong from a management perspective, what can go wrong from a technical perspective. And that's why healthcare fails to deliver, because we take these two things away. The moment you bring health, technology, and management, you actually deliver healthcare. And then, of course, the course has 3 levels. We wanted to make sure that people understand it in the language they need to, not technical jargon. So it's the basic level, which is theoretical aspect. There is advanced, which is the technological part of it, and professional, which is application part. And we looked at people. We did, I think, discuss with at least 300 people on what are their expectations from a course like this. So you can understand the diversity of expectations of people. First is to gain knowledge, which of course is very critical. I think as technology also evolves with time, we need to understand in that mindset that how it evolves. Then challenge ourselves. So the best part of course like this is that, well, it tells you where we are today. It probably tells you where we are going, but the the main goal is to challenge the people in the screen on the screen is like, how are you preparing for the future? And understand the nuances of implementation, which you will learn as you go along in this course. Become tech savvy. I mean, I think there is no choice for people into healthcare to not become tech savvy. You have to. Then is networks. The networks that we are creating through this course, the first batch of 47 people are phenomenal network of people. I think they will end up being leaders to tell others what to do in digital health. So we even talked to a lot of people, and they reached out to us, people who are MBBS, MD. The goal is to integrate digital health into what they do. And the best part comes is the first ones who do it. The first ones, the early adopters, as we call them, are the ones who will lead that domain. And then transition from admin role to admin roles. Most of the people also into medicine, into practice, would find ways to be entrepreneurs or to be transition to admin roles, into future prospects, and connect with patients. I think recently we did this conference where we got doctors talking about how technology usage has connected them, brought them closer to patients, led to better outcomes. So as we release that report for the next week or so, you will learn that technology actually doesn't take the doctor's touch away. It actually makes you get closer to the patient. And this is what we actually have tried to do through this course. Tackling gaps in primary care, using tech to solve problems. New therapy areas are coming in, where technology is also a solution. Then improve experience and the quality outcomes. Identification of digital tools, digital health in everyday life, and digital transformation is the end goal. Whether as doctors, so luckily we have today Almas, who is a futuristic clinician, wants to only be on the tech side of practice, which is phenomenal. And that's where I think eventually future is going to be. So we identified some of the focus areas for the course where people have to look at is the use of artificial intelligence, machine learning, data meaningfully. So while I think as people go along, they will understand how do you visualize data, how do you use data for your practice, software as a medical device, cyber security and patient safety, and product development. So this is going to be very much application to anyone who's runs an online clinic, sets up a new hospital, how to get patients to hospital, and how to improve healthcare as healthcare provider and support clients in digitalization. So multiple use cases for those who are enrolled in the course. And the journey so far, I think now it's over 3 years, 60 plus leaders, and we have partnered. So one of the big difference that we have done is that we have partnered with top management institutions, with their top professors, with the great industry leaders all over the world for this course. That sets us completely apart in terms of the practicality of the course. And the format is flexible recorded lectures. We have webinars with faculty and experts. We have live interactions and live lectures. So far, people had the opportunity to interact with the world's top leaders on a webinar directly. There's a quiz, so you test your knowledge. And then we have been very practical in terms of pass marks being 50, which people had to learn and observe. So it's not, in a sense, very, I would say you can just enroll and pass. Yes, you have to spend time, be focused on it. And then there's a dissertation and internship for the people. And then contact program at IIM Raipur, which I'm sure would be like an immersive one where people actually understand from the people, live talks, live lectures, doing joint programs. And then people can ask queries. We have a WhatsApp group, people interact there. We are all there to engage with them and help them solve the problems. The faculty comes from the world's best. So that is one thing I think Dr. Sanjeev also made this point. So one thing that always will be asked to you, you can do a digital health course from probably anywhere. I bet that the next few months to 1 year, dozens of courses will come. But one thing that you should always remember when you do a course, who taught you? So when people tell that these are the names who taught us, like for us, we have been very careful to bring the world's best faculty. So if you really look at the people, we constantly strive to make sure that it is the world's best, not a theoretical professor teaching you anything. That is something that I think gives sufficient comfort to people taking this course. And even when they go out, those who eventually go to seek a job will be asked, who taught you digital therapeutics? So if you tell it's Anand Iyer, people won't question you because the man who founded this field is this Abhirup or Dr. Joe Quader or Pakul. So these are the people who have developed this field. Those are the people who have driven this field. These are the people who are shaping the future of healthcare through technology. So we have been very, very careful to get the top people. Like if someone talks about standards, interoperability, everyone knows the man who developed FAR standard is Graham Greaves. So if we had to do a course on standards, who better than Graham Greaves, the man who founded the world standard? So our constant thrive and innovation through this course is get the best people on the management, whether it is supply chain or anything. You will see, you will meet the people who are trained in the best campuses in the world. They understand the nuances of practical implementation. So this is something that we have striving continuously as endeavor. And the first cohort, of course, is a mix of academicians, senior industry leaders, pharma professionals, doctors, medtech professionals, digital health professionals, and allied healthcare professionals. So quite a diverse and yet a very passionate group of people. And this is something that we had a very cautious, decision about, that bring two great institutions together. Management is something that as Digital Health Academy, we would always look at IM, so that we bring the best of management practices to the people who are doing this course on digital health, because digital health alone without management would be incomplete. Even if you tomorrow go and start a company or a business or even want to roll out, you still need to bring the management perspective on it. And that's why I think this relationship, this partnership is a very crucial one for us. And that sets this course very much, as a sought after. So our vision is not about people just doing, I think, eventually ordinary jobs doing this course. The one thing is there will be leaders at the forefront of digital transformation. So our goal is to create those leaders through this course. And this is what is the continuous endeavor to improve, improvise, and build upon. How do we create leaders for the future? How do we create leaders in clinical practice? I think so far the progress that we are doing, as we build, as we deliver the course, we're still looking at what more value can we bring to the people. And in that process, we try to get the world's best to not only share knowledge, but to also inspire. Because in digital health, I think it is inspiration which is more important. When you meet those people who have transformed it, like Dr. R.S. Sharma, who built Aadhaar, who built CoWIN app, and was the CEO of NHA. I mean, there is no better person than him to tell how to build the world's largest digital health platform. Or Dr. Jay Sanders, who actually, in one sense, literally invented telemedicine as a thing. And then you get to meet Dr. Sanjay Sood, who built the world's largest telemedicine platform. And then Sabindi Ma, who is lady innovating using AI and blockchain. A lot of people talk about blockchain and AI. How many have built it to scale? This is the guy who built it to scale. So for us, if we have to create global leaders, you need to be taught by them. It takes a lot of effort to do that, but that is what will set this course as the best course in digital health. And our vision is that if we have to create you as big leaders, you need to be taught by the biggest in the field. So we keep continuously looking at where we stand. I think we are fairly excited, and this also makes us more responsible, I would say. Is that when people trust us so much, we need to go beyond what we are doing. So our continuous endeavor is that once you start rating us at 96, 97 and 100%, that means we need to still do more. I don't think we should sit down. My team is continuously saying, if they have put so much trust on us, we must deliver them more. So I think as every week, every month passes, you will see that the level of knowledge we impart is much, much higher level than an expected one, at least in this field. Any questions, happy to answer. And before that, I would like a very senior person who has joined, and someone whom I have a very high regard for, Dr. Sunil Khetrapal, who is a clinician and was a part of India's Tertiary Institute, Rajiv Gandhi Cancer Institute, where I met him a few years back. And he's a role model for those who think that they should be into this arena, taking digital health. So Sunil, what has been your journey, why you decided for this course, and what has been your experience? Mute. Sunil, you're on mute.
Yeah, good evening to all. First of all, I would like to thank Dr. Rajendra Pratap Gupta for inviting me to this webinar on why digital health is important and why should someone opt for this course. I think, before I entered into this course, I was having a very vague idea, very vague knowledge about digital health, and there was no conceptual knowledge about digital health, and I was always curious to learn. And as you have seen that I'm, one of the very senior, most probably the professional who is pursuing this course in the first batch. And I'm a keen learner, of course. So I thought, let me, when I came to know about this course in LinkedIn, so I tried to just find out about the course structure, the faculties, and I thought, let me, go through it, go through this course. So then finally I got selected. Thank you very much. And then once I started this course, I started developing the interest and started learning new things, very basic about digital. Then I realized that I did not even know the basics of digital health. You have this terminologies, digital health terminologies. I was not even aware of some of the terminologies and not aware of the meaning of those terminologies. What do they mean? So this was how my journey started. Then I started, developing interest, and I thought, no, I got a passion towards this course, and then I found it very interesting. And the journey in the last maybe 5 to 6 months have been very interesting and very challenging, of course, because apart from my busy schedule, I have to study a lot. It is not that you just, it's because this is a course which is offered by two leading institutes in the country. I am Raipur and Digital Health Academy. I mean, hats off to you. The way you designed this course, it took 3 years for you to design this course. So you have evolved. The course has evolved, and I myself, while I'm into this course, even I am evolving. My digital health knowledge. I think it is now should become a way of your life. And as you always say, that digital health is so important that it is, of course, it's now a game changer. And without digital health, there is no health. And of course, there are many benefits. And if you see the whole digital health ecosystem, there is so much into it. I mean, your first lecture in the beginning, it started with the digital health ecosystem. Then I learned that what is a digital health ecosystem? There is so much into it, starting from the policy, regulatory framework, the leadership and governance, and then other elements of the digital health ecosystem. The standards are there, the communication network, bandwidth, then your partnerships, research and development. It's so much. So finally, I realized that it is something which is actually in need of an hour. And the more and more I was entered deep into this course, I realized that I'm becoming wiser, of course. So, and of course, then I realized the benefit of this course, that it is not going to benefit me only after going through this course. It benefits all the stakeholders, the end users, the providers, and the whole healthcare system. So I think most importantly, when I will correlate it into the application of digital health into clinical practice, I find that there are so many benefits, and we should highlight those benefits. And why do we need digital health? Why should we opt for this course? So we talk about improving quality, we talk about improving patient safety, we talk about improving the cost effectiveness, we talk about addressing the health equity and accessibility, affordability. Of course, ABDM is a big example, which is the flagship program of National Health Authority, and then interoperable health system, which is something, I mean, it's very important. And of course, everything is patient-centric. It is also enhancing the physician's experience, not only patient experience. The patient satisfaction level is increased. Also, the physician's experience level, I mean, the satisfaction level by enhancing their experience is increased. And then it also, there's a tracking of personal health records. So there's so much into it. I mean, there's so many benefits. I think I finally realized that I have no regrets, and I'll pursue with this course. And I was very fascinated by Dr. Sanjeev Parashar when we met in Global Digital Health Summit. What he mentioned to us was that after pursuing this course, our batch, we are not going to leave you. So that was the best part. I think I thought that we will be kept engaged even after we finish this course. We will be kept engaged for counseling the subsequent batch, and not only knowledge sharing, and maybe we will be part of that ecosystem of this digital health program, your certification and this program. So I think this is something, it is, we not only feel educated, we will be empowered, we will be engaged even after pursuing this course. So the journey is continuous. It's a continuous journey. It's not that I finish my course and then I'm done. And हो गया, उसके बाद भूल जाओ क्या है, कुछ नहीं पता, कोर्स कर लिया, डिग्री आ गया, certificate आ गया. So that is not the way. That is not the thing. We also should think something very big. We should also think a long-term benefit of this course. As I really appreciate Dr. Sanjeev, which he said, no, we are not going to leave you. You will be part of us. So that was the best part of it. So this is my experience, what I have shared, and I would love to recommend, and I actually, keep talking to people, and I feel proud in saying that I'm pursuing this course, and, people are very curious, and then I try to, tell them the benefits of this course. And so I'm a brand ambassador for, for propagating about this course.
Dr. Sunil, more
from my
important,
side. That's all from my
more,
side. Yeah. Thank you.
more important message from people like you who have been at very senior level for a long time is that you can get a sense that healthcare is changing. It's an inner feeling that comes that, oh, look, I've learned things for last 30 years plus, I have done things, but healthcare is changing now. And so I need to change now. And what we develop, so here, as I said, that we are building leadership for digital health, for healthcare transformation. So question of leaving any of our 47 batch members is not possible, because this is a very integral chain of trying to transform health. On one side, we have people like you, we have people like Almas, we have others. So I think in the next 2-3 days, as this long weekend passes, you're going to get those projects of how do we look at the transformation of health as a big system, because if you have learned so much, you should actually now be able to bring that paradigm into the practical application and work for the next 2-3 months, so that by the time you pass this course, you would have a template divided into groups which can show and lead the healthcare transformation. That is what we have to do, because this is not, as you said rightly, this is not a course you get your degree and you're done. The work continuously starts. We all come from a background where we know healthcare probably a bit, but we know that it's transform mode. So I think that's going to be a continuous part of it. And that's for sure, given that no one completes a course in that sense and goes, it is actually a hand holding for the future and transforming it. So Almas, it's good to have you. As we call the tech generation. So what brought you to this course, and how's been the experience for you, and what are you looking forward to?
A very good afternoon to everyone. I'm Dr. Almas Fatma. I hope I'm audible.
You are.
Yeah. So first of all, I would like to thank Dr. Rajendra and the team behind today for having me as a speaker and providing me an opportunity to share my view as to why digital health training is important. So Dr. Sunil and Dr. Rajendra have already highlighted everything. I'll try not to be repetitive. So I started teleconsultations during mid 2020. I stumbled across it. I wasn't aware. I was just doing normal teleconsultations. That's it. But while I was practicing, I really wanted to learn more. And I looked everywhere upon the internet, and there was nothing really substantial. And then, as a member of the Telemedicine Society of India, we had one of our newsletters, which, there was about this course, about the Digital Health Academy's course. And I just applied, and I was sure that I won't qualify for it because I had already bought the course book, Dr. Rajendra's book. I bought it before even I got admitted to it because I was so sure that I won't qualify. But yeah, thank you so much for having me on board. And when I started this journey, when I entered digital health, I wasn't aware that there is something like this. And I was ashamed, and I'll say this out openly. 2 years, I was ashamed of telling people that I work as an online consultant because people would question me, ridicule me, literally mock me. Okay. And fast forward to today, I have attended 2 conferences recently, and I have had um, doctors coming up to me and asking me about what is digital health, what is teleconsultation, what more options do we have. And finally, I have gained my confidence, I would say. And I would like to remind that in this fast forward world, there are 2 things which are constant, that is learning and change. Other than Shah Rukh Khan's charm and delicious biryani, I think learning and change are always constant. We need to embrace them wholeheartedly with a positive approach, not just for the betterment of us as individuals, but also as society. See, people have this really wrong notion, digital health is and was never about replacing doctors. It was always about enhancing human touch with technological brilliance. Okay. And because digital health training, if we take, the healthcare workers will be consistent. Okay, they'll have evidence-based approach towards patient care, increase in quality of care, health equity, access, training, all these things. We all are aware about it. But then we do have several misconceptions about digital industry. What I have come across when I have conversations with healthcare workers per se, specifically younger generation, they have, that there's lack of awareness. There's lot of lack of awareness, and the misconceptions suggest 3 things, and that's lack of knowledge, lack of training, and lack of understanding. And usually it's a combination of all 3. And this is exactly where Digital Health Academy and IIM have come up with this diverse and comprehensive course about digital health in healthcare professionals. And of course, it covers a wide range of topics, which Dr. Sunil has just spoken. I would try not to repeat it again. So, see, since ages, most of us have blindly been following that, if it's not broken, don't fix it. Why do you have to fix it? Kaam chal raha hai na, to chala lo. That has been the mantra. And that attitude is what resists learning and upskilling. So the question that arises is, how can one adapt to broader changes in their field if they are stuck to old methods? See, people ask me this question. We have good practice, our old methods are supporting, what is the need of this? My question is, for how long? What about the growth? How are you going to catch up with this rapidly evolving industry? Because I keep telling people, I joined this course, I've learned a lot, we have come a really long way, but every time I cover up a topic, 10 more things are coming up again in field of AI, machine learning. It's like never ending. So those who are resistant to change, the day when arises that you have to accept it, you want it or you don't want it, it's going to be a really long journey to cover. And again, as I say, this is exactly where the course has come up, meticulously designed. It puts tick marks on all the 3 things that I said regarding misconception, knowledge, training, and upskilling. Because if no proper training is undergone, which is necessary for progression in our field, I shouldn't say this, but we might end up with incompetent people in positions who won't be able to justice to. And then, of course, the inevitable happens because, you know, consistency and experience is going to come when you do the job, you progress at stages with the skills that you have learned. And that is exactly what this course is based upon. And we as healthcare professionals have a huge responsibility, to work for the betterment of people. um, yes, we Dr. Sunil has spoken what all topics have been covered in our course, and Dr. Rajendra has also shown up on the slides. I'll try not to repeat it again, as I said, and I'll keep it short. But at the end, I'd like to say that, as that we should keep citizens, or let's say patients, at the heart of our digital health transformation efforts. And I say efforts because that is exactly what we all here are doing, especially Digital Health Academy. Because The people are the reason we do what we do. We are here to give service. And for everyone present here today at this webinar, I hope that we all take a step forward in upskilling ourselves in digital health, embracing technology for the benefit of not just healthcare sector, but also for the people globally. That's all that I would like to say.
Thanks, Almas, and I can relate to what you said. And I like the line that don't fix till it is broken is a mantra that we followed, and that's not going to work. And you know what you
Is
just
there a
just sent me an yeah. So
So we are
I ended.
losing your screen.
Okay. Am I clear now? I'll just shut off the video. Better, Ravish?
Yes, sir.
Okay. So sorry about that. So I can relate to what Almas was saying, you know, that the old mantra of don't fix if it is not broken. I think that's something that everyone should remember. I think people on the screen are clear personification of that mentality. Sunil, I mean, he could have said, I am a very eminent person who in healthcare doesn't know me. Why should I do the course? But then it's an internal thing that you need to. I mean, now in healthcare, do people don't know Sunil? And everyone knows. I should Almas. I mean, she has a bright career ahead. She has done a good degree. She is in Pune. She could actually spend money, but she knows that if I'm not using technology, I'm not a professional looking at my patients, because technology actually ends up you being professionally committed to your patients. That gets you tools to do that. So I think this is something that everyone should know. And I'm going to take the questions that are there to answer to people. I think there is a question about course for healthcare professionals having a background in pharmacy. Yes, we do have currently people from pharmacy in our course, very much. And then I'm an MBBS doctor working in state government as medical officer. So what are the future career opportunities? So we have very senior government people also on our course. And I'll tell you what I see. So you know that ABDM is now reality. We have 44 crore Abha numbers given out, will be 100 crores in a year's time. But every state department would need trained people. In fact, every organization, whether private or public, would need people trained in digital health. As Alma said, you know, as Sunil said, that even the terminologies are probably, you know, something that we should understand. And this course actually gives you a sense when you sit with someone today and you start talking about future of healthcare. And if you do not tell them that these are the tools I think we need to implement, then actually, you know, we probably are not doing service to our profession. We are not professional. I think so. This is how the world is changing. Last week, Commonwealth formed the AI consortium, you know, for looking at transformation. And I'm tasked to lead the capacity building across Commonwealth. So the kind of things that multilateral bodies are doing, you know, for the population, because one of the things, let me make it clear, you know, while we see that those who don't use technology will lose jobs, forget jobs. I think even organizations would cease to exist. The way AI is getting into, so you need to learn AI to use it, because that's going to be critical. You need to understand various dimensions of newer technologies that are going to be applying to your sector, healthcare across sectors. In fact, one of our students asked us that I'm a dentist. Is there something for that? So our course covers broadly all technologies. We actually reached out to a top institution who is actually implementing technology in dentistry. I requested them, I would want a video from you on how do you use technology in dentistry. We actually got it. So as Almas also said, our goal is to make sure we equip you. We don't have to give you what you call a cookie cutter approach of a course. We have created a partner with IIM. Here it is, take it or leave it. No, there is a constant endeavor, and this is what is in our you know, what we put as the course structure, that it will change with the evolving needs of time. So we realized that, okay, I think in dentists, I had personally seen in that hospital how they're using 3D printing, doing the patient discharge the same day. I actually got them to make a video on what they were doing in reality. So all application oriented. We are supposed to be letting people be updated on the future. And more than that, like if you're working for a state government, so our first batch will get a email, I think probably tomorrow or day after, about 3 projects they need to work on. One is for the, you know, the National Digital Health Mission. How do we make it more effective? What are the best practices to take from Estonia, Canada, US, and even our own National Digital Health Mission, the Ayushman Bharat Mission. And how do we make our healthcare more outcome driven using technology? So having learned from this course, people have to become consultants, to help large scale deployment transformation of health. I mean, we have to do that. I think the course is supposed to equip you on that. So there are other questions.
Rajan sir, let me answer some of these questions.
Oh yes, please. Professor Ram, go ahead.
So first and foremost question is, will I get placement assistance if I enroll for this course? Formally, no from IIM Raipur, but informally, definitely enough networking opportunities, which we all provide, and both Digital Health Academy and we will endeavor to ensure that fair amount of networking is done. Does the course is designed for health? Second question, the course is designed for healthcare professionals, but looks like will it help people whose background is not really healthcare background, but want to understand the users and importance of digital health? Definitely. I think this course is largely about cross-functional perspectives. To give you a very quick example, we have a person from US attending this, who I think is working in Bank of America and pursuing this course in the first batch. So largely speaking, doesn't have any digital health background. If you can clearly see, he doesn't have any healthcare background, but does see a lot of potential and hence has joined it. Next question. Is there a course for healthcare professionals having a background in pharmacy? At this stage, our only product is this. I'm sure in future, as and when the demand pans out, probably maybe she'll be able to answer this afterwards. But as of now, I'd put it this way: a joint collaborative course on these lines is definitely not there tailored for pharmacy. Next, I'm an MBBS doctor working in state government. Can I join this course? If so, what are the future career opportunities of this course? That is for you to figure out future career opportunities. But as has been pointed out by my eminent friends and colleagues out there in the seminar, I guess the fact that we've got two eminent senior professionals, Dr. Almas and Dr. Sunil, coming and talking itself conveys a lot. Next is this course meant for the freshers in the healthcare domain? I guess there are certain norms, but Mevish will be able to respond to this, or maybe one of my colleagues, Professor Sanjeev, might be able to do it. Next, I have a question for Dr. Almas, who has been implementing digital health and implementing the same in your practice. Have you seen any change in your patients? How do they adapt to digital health? So that's something I think Dr. Almas may like to answer. Next is again the placement opportunities. Thank you. Are there any international placement opportunities? How can we get it? Look, this is not a job providing platform, is something which I'd like to clarify. While there are opportunities galore, but I think some risk ought to be taken by each one of us at certain points in time. How will this course help me if I'm an IT professional working in the healthcare industry? As I pointed out, if IT professional working in Bank of America is joining this particular course, I'm sure you would understand what are the benefits out there for, you can say, anchoring yourself into digital healthcare before others go ahead and jump into the bandwagon. Is there a scholarship for doing this course? No, not at this point in time. Would we get an idea on organizational design for healthcare delivery? I guess so, definitely. And some of the questions, I think, Mavish, would you like to jump in, and then Almas, maybe?
Sure, sir. So regarding the freshers, if you have zero experience, but you are of 25 years, you can apply for diploma course. Minimum 2 years is required, a working professional with 2 years of experience for postgraduate certificate program. I guess this was the one question. And
Can I answer the one on the placement assistance?
Yes, sir.
So I'll tell you what our vision was. That first thing is that the world really looks at people who are trained. And I think at one time, a friend from NHS actually gave a video, and we didn't want to oversell this course. So I'm just saying that we never put that video out. He said, I'll be willing to hire people in NHS if people to do this course. We never put it. We don't want to sell this course. That's not a goal. I think Dr. Ram made it very clear. And I'll give you the other side. So what we are creating is the directory of digital health professionals. So tomorrow, any company in the world looks at, looking at hiring people. We have a directory of certified digital health professionals, which we will do who pass out from this course. So very much open to that. We actually promote the profiles of those who are doing the course. We seek their consent and promote the profiles that these are the people enrolled in the course. And once they're done with the course, we will list them on our directory that these are the certified digital health professionals. So as you know, the course is already endorsed by ISFTH, which operates in 117 countries, which is an international society. It's endorsed by the European Connected Health Alliance with memberships across the world. So we have those networks. Dr. Ram made it very clear. I'm just making it more granular that we have those networks in place to promote the profile of people who do this course. And I would also chip in on the IT part. So for anyone who is looking at learning from the world's best here, and we bring people from cross-functional experience globally so that it opens your eyes to newer possibilities. So that's an endeavor, that is there from our side. And maybe to you back and then to Almas.
So I guess I had only one question for me. I guess this was for the freshers thing, and Almas to you.
Yeah, Almas.
Can I just go to that question? Yeah. So it is like, what has been your experience learning digital health and implementing the same in your practice? Have you seen any change in your patients? How do they adapt to digital health?
So I am having absolute fun with the digital health course. And as I said, I was already practicing before enrolling in this course. But yes, as I said, I have gained more insights how things should work. And speaking about patients, as a general physician, I work as a family physician, diabetologist. Most of my patients, I won't say most, 100% of my patients are recurring, because I work as a family physician. I have a very good terms with them. If you are asking about how things work, basically there are many health tech IT platforms who manage your portal. Okay, your website portal, your page, booking appointments, they follow everything as per the rule. Just make sure that you follow the telemedicine guidelines. There are certain guidelines, do's and don'ts, that you need to follow when you are doing consultations. And I wanted to speak about, there are many people, most of the questions are based on placements and career opportunities. See, as a young doctor, okay, I've just entered my 30s, okay, so this is such a rapidly evolving field that we all know. We don't have a set of designations that will be allotted. This is something which is evolving. To speak about few, for instance, there are certain projects that are coming up now in field of AI and ML. Due to NDA, I cannot give more details about it, but there are certain projects which are coming up, and healthcare professionals are required, because AI and ML in healthcare field, who is going to help out in those projects? Those are the doctors. Who are those doctors? Those who have some training, some knowledge in digital health. Because I have got these, I like these opportunities have come up. That is the reason I'm telling you. And if you're interested in learning about digital health, you want to know more, you want to learn for yourself, you need to do that first. And then, definitely opportunities in terms of career are going to come your way. I would say, let's not directly think in that path ki, I'll do this, what job is there? This is not like engineering, medical, CA, that you get this degree and you have these jobs available. And sometimes you've got to take risk, but always remember, taking up this course is not going to hamper you from your previous job options. You'll always have that, but with that you have more add-ons coming up. And trust me when I say this, there are a lot of new job prospectus that are going to be created in digital health field with health and technology coming in together.
Albus, now I will request everyone on the screen to give their last key take-home message. Dr. Sanjeev from you, Sunil from you, Mahesh, and then final word is from Dr. Ram.
Sir, as I started the session and I shared, there's a vast opportunity, and very important is the harnessing of technology into any education would always add up. This is the course which exactly the most critical or X factor of this course, I always say, is the program is being asynchronous, yet you have an access to the faculty available worldwide. Dr. Rajendra, I just want to remind you of the two meetings we happen to have, one in Delhi and the second in Mumbai, the annual workshops you conducted. First time, I just bumped into a man called Bakul Patel, who happens to have drawn everything over there at Google. Now, having access to such people over there is what exactly is a very positive essence of the course. And each and every answer, most of the questions as were put out over there, specifically placements and all. As Professor Dr. Almas also said, there's a lot of scope coming within. Peer learning will help you get hooked from one particular position to another position. You might see yourself jumping from one particular body to another big policy making organizations internationally. There's a lot to come over there in our way. And that's what exactly it's a time for we people to take a decision and move on. The best of the resources, the best of the content, the best of the people, and very importantly, a space or in the term or called immersion, wherein each one of you people will even come. You have an option to come down to IIM Raipur, interact with each other, learn, and maybe move back. And that's what exactly is a say from my side. Ramkumar sir, over to you, sir.
Right. Mavish, you would like to go ahead?
I would just like to say batch 2 applications are open. Please register and be a part. Become a certified digital health professional. Thank you.
Sunil, you want to say, and then last word from Dr. Ram? Dr. Sunil?
You're on mute, sir.
Yeah, see, what I would like to mention here is that, not about this course. It is not only well structured with very eminent faculty, the national and international faculty, but it is also a well managed course. The way we are taken through this course, we have a WhatsApp group and, the webinars and the way the study materials are there, and, it's a self-paced course. So I think overall, it is you feel comfortable and convenient also. It is as per your convenience. It is not binding that, so that is something, a good part of the course. And lastly, I think it is not just the technology or the digital health we must think about, but how we modify the existing human system and also the health system to be more inclusive. I think that is more important. That is more important. And lastly, I have read somewhere in the book or somewhere in the study material, which was given to us, that it said that what is allopathy to the traditional medicine is, digital health is to modern medicine. There's somewhere, I think I've read it, I'm just quoting that only. So that's all from my side. Thank you very much.
So to my friends who are contemplating submitting the application or applying for this, please understand that it's not a walk in the park, in the sense your applications will be processed, certificates will be checked, and also a very brief, very minor, quick interaction will also be arranged. The idea is you would agree that you would love to be part of a community which makes you feel proud and wherein your self-esteem goes up. And in that sense, I would be honest in saying, I go ahead, thank my colleagues out there, Professor Sanjeev and also Dr. Sunil Saab, to they both so nicely summarized it. up to you, but opportunities do not come twice, thrice. That's how I'll put it. Thank you so much and best wishes.
Dr. Ram, thank you so much. And to those who joined us today, don't create your own competition by waiting for too long, because we would only come with the next batch in 2024. So I think use the opportunity, and I assure you that what you join as a learner, you will come out as a leader. That's a promise to you. I wish you good luck, and hopefully we'll see you. Thank you.